Hello friends, today I am back with the second episode of Tips in Neurology. Tips means 10 interesting points shared. So basically today I will talk about migraine. And so number 1, what is migraine? So migraine is the commonest cause of headache in the world. We can say almost 10 to 20% of world population they suffer from migraine every year, and it is more common in women. Second is, what are the common symptoms of migraine? The commonest symptom of migraine is headache. Other than headache, other symptoms can be nausea, vomiting, increased sensitivity to bright lights, or noise. And if you look at the headache, it is described as pulsating or the throbbing type. The third point is, how long do the migraine attacks last? So typically the headache of migraine, it lasts from 4 hours. So the duration should be at least 4 hours, and the maximum is 22 hours. Only in very rare cases the migraine headache can go beyond 72 hours also, up to a week, and that is called as status migrainosus, but that is rare. So typically it is from 4 to 72 hours. The fourth point is whether migraine affects one side of head or both sides. So typically migraine affects one side of head, but more commonly it can affect both the sides also. Other locations can be back of head, behind the eye. So basically any of these parts can be affected. The fifth point is, what are the triggers of migraine headache? So the commonest trigger we find is stress, lack of sleep, fasting, certain odors like strong smells, perfumes, also certain foodstuffs like Chinese food, cheese, cakes, chocolates. But the kind of triggers may vary in different people. So it is not the same in everyone. So be on the lookout for triggers and you may find them. Number 6, is migraine familial? So we do see a family history, means people who have a family history, they have a higher risk of getting migraines. For example, if one parent has migraine, there is 40% risk in the child. If both parents have history of migraine, then it is almost 25% higher risk. And so those who have a family history of migraine, they have 3 times higher risk of getting migraine. But we do see people with migraine who do not have a family history. So roughly about half the patients who come to us, they do not have a family history of migraine. And then the seventh point is, which gender is more commonly affected? As I already mentioned, women are more commonly affected. So it is about 3 to 4 times more common among women. And it is supposed to be due to the hormonal changes that occur in women around the time of menarche and up to menopause. So that is why you find that some of them also, the headaches do get worse just before periods and the first 1 or 2 days of periods. And second thing we notice in women is that during pregnancy, the migraine headaches are much less, so they are not as common. Then the eighth point is, which age group is affected? So migraine is a disease of younger people. So it is a disease seen in children, adolescents, and young adults. So the commonest people who are affected with migraine, they are from the ages of 20 to 40 years. And after 40, the prevalence of migraine reduces. In old age, it is not common. So typically when we have a person who is more than 50, we should not think of migraine as a first diagnosis when that person comes with headache. We should look for other causes also. Ninth point is, what is aura? So some people with migraine do have symptoms before the headache starts. The commonest is visual aura, where they can have bright flashes of light, zigzag lines, or fortification spectra on one side or both sides, which may last for a few minutes, and that is followed by headache. And same aura can also occur like with certain smells or certain sounds or some kind of tingling or numbness feeling or weakness. So and then these symptoms last for a few minutes and then the persons have headache. That is called migraine with aura. Earlier it was called classical migraine. But many people with migraine may not have aura. Almost we can say 75% of migraine patients do not have aura and about 25% only have aura. And the 10th point in migraine tips is that what is the treatment? So those who have occasional headaches, that is once or twice in a month, they can take certain pain relief medications, commonly NSAIDs, analgesics, and specific ones like triptans, and they are effective. But of course, they should not overuse them. And then the people who have frequent headaches, like say 3 times or more times, number of times than that in a month, or more than once in a week, they require preventive medications. So in that we have certain tablets are there, and then in whom tablets do not work, other options are there like Monthly injections are there which can be taken just once in a month. Also Botox injections, where injections are given in the scalp muscles. And then we also have certain devices which can be worn on the hand. So so there are various methods of treating migraine in a person who has frequent headaches. So the bottom line is that migraine can be diagnosed based on the symptoms, and there are excellent medications to cause relief in the symptoms. And once you know the triggers, you can prevent many episodes of migraine. So I hope you learned something useful, and have a great day.